Doctor, someone else will edit this, so your name and title and who you work for.
Yeah, absolutely. So my name is Sujan. Talk to you. Okay. My name is Sujan Gogu. I'm a family sports and pain physician for South Texas Health System Clinics.
I think the biggest remark that jumped out of the page for me when you were speaking is with this connection between COVID and diabetes. And there was a story in the Dallas Morning News the other day that said that if you've had COVID, you're more likely to get diabetes and things like that. And now today in your presentation, you say you are really worried going forward with children that have got COVID and potentially have diabetes in the future. Expand on that if you would.
So the reason I'm really concerned is I think the Rio Grande Valley has a lot of risk factors that put patients or put people at risk of developing diabetes to begin with, whether it's the Hispanic culture and what we eat, in terms of genetic propensity, in terms of how metabolic syndrome is really prevalent here in the valley, in terms of how a lot of adults, really when you look at adults, their kids are a reflection of the adult. And what I mean by that, and the choices they make to eat and the choices they make to live. And now that you've got COVID on top of that, which is now creating an additional risk factor to developing diabetes, which the link is still trying to be studied more in detail, that's going to be scary because we're going to have a lot more people that are going to be diabetic when it's all said and done.
And so you were saying in this conference, this symposium today, that a few years from now, there's a certain age group. You're concerned about what our health situation is going to be.
Perfect, yeah.
At a certain age group.
Absolutely. So I think when you look at the kids that are particularly are healthy right now, that haven't developed any health problems. What I mean by that is ages 5 through 15, because that age is relatively healthy. But the problem is as we get older, we have more socioeconomic stresses that are out there. When we have our job, when we have a family, our health really gets taken aback. We're not as active anymore. And that's when it's becoming a huge risk, and that's when you could possibly develop diabetes. And so if we get a lot of 25, 30-year-olds that develop diabetes, as they get older, those complications are going to get worse.
Next question. You talked about the social determinants of health. Define what that means and as it affects the valley. What are you looking at?
Yeah, absolutely. So when you talk about the social determinants of health, there's really 5 factors that you really look at. And unfortunately, this affects a physician and how we take care of our patient. Education, access to health care, economic viability of yourself, environment, and community. And if you look at that all affects the health of a patient. If you don't have the economics to afford a medication, that affects you. If you don't know what diabetes is, that affects you. If you don't have access to a physician, that affects you. If your community is unsafe, that affects you. If the environment around you is unsafe, that affects you. And so that's how it affects health. And that's why it's such an important subject.
And then you also mentioned the patents that are out there for insulin. It seems as though your view is it's far more expensive than it should be.
Oh, 100%. I mean, if you look at the person that invented insulin in 1923, that was sold to the University of Toronto for $1. And imagine how much Big Pharma is making on that. That patent now, if you look at inflation-adjusted value, would be about $16 to $17, just a patent. You can't buy insulin for $17 on the open market right now. The administration, right now is in the Build Back Better bill, was trying to cap insulin prices, I believe, to $35. Unfortunately, that bill hasn't passed, but that would still be more pricier than the patent with inflation-adjusted value now. And it's just crazy how Big Pharma has really gouged people of money.
Yeah, because a bit later in your remarks, you said Big Pharma is making many things difficult for the health of the population.
Absolutely. So when you look at diabetes, it's been a big moneymaker for them. When you look at how much test strips cost, how much a glucometer costs, how much biowearables cost, how much insulin costs, it's a lot of money. And a lot of this is not, unfortunately, it's not covered with insurance. And so they're creating all these amazing products and they're selling them, but if it's not covered with Medicaid or Medicare, what good is it?
Anything else you'd like to add, Dr. Gogu?
No, not really. Yeah, I think I covered everything. Yeah.
Thank you so much
Yeah.
for today's interview.
Yeah. Thank you. Thank you so much. Pleasure to meet you. Yeah.